Welcome to our video on hip special tests. This video will cover all the key hip special tests, providing detailed explanations and visual demonstrations. We hope you find this to be an informative resource. All right, let's start with an overview. The main objective of hip special tests is to assess hip muscle flexibility, joint integrity, and neuromuscular control. These tests help us identify various categories, including muscle tightness, structural restrictions, nerve or sacral involvement, and pelvic symmetry and control. This slide displays the Thomas test. This evaluation technique is used to identify hip flexion contractures, particularly of the iliopsoas muscle. The patient is positioned supine on a table with one knee drawn towards their chest. The examiner stabilizes the pelvis and slowly lowers the opposite leg. If the lowered leg cannot lie flat on the table, it indicates a positive finding, suggesting tightness in the hip flexors. The image clearly demonstrates the proper positioning and technique for this test. This slide describes the Ober's test. This test is used to evaluate the tightness of the iliotibial band and the tensor fasciae lati muscle. The patient is positioned side-lying on their unaffected side, with the lower leg flexed for support. The examiner stabilizes the pelvis, then abducts and extends the patient's top leg, before allowing it to drop towards the table. The image shows the examiner supporting the leg. A positive finding is when the leg stays elevated and does not lower fully, indicating tightness in the IT band. Next, we have the FABER or Patrick's test. This test is used to screen for hip joint dysfunction or sacroiliac joint issues. The patient is positioned supine, and the tested leg is placed in a figure 4 position, with the ankle resting on the opposite knee. The examiner stabilizes the contralateral ASIS and applies gentle downward pressure to the knee of the tested leg. Pain reproduction in the groin or posterior hip indicates a positive finding, suggesting hip joint or sacroiliac joint dysfunction. Now, we'll discuss the piriformis test, also known as the FABER test, which stands for flexion, adduction, and internal rotation. This test is used to detect tightness in the piriformis muscle or sciatic nerve entrapment. The patient is positioned sideline on their unaffected side. The examiner flexes the patient's top leg to 60 to 90 degrees and the knee to 90 degrees. The examiner then applies downward pressure on the knee while performing adduction and internal rotation of the hip. Pain in the gluteal region or radiating down the leg, similar to sciatica, indicates a positive finding, suggesting piriformis tightness or sciatic nerve irritation. The hamstring 90-90 test is used to measure hamstring flexibility. The patient is positioned supine, with the hip flexed to 90 degrees and the knee bent. The examiner passively extends the patient's knee. The image shows this position, with the examiner extending the leg. A positive finding is when the knee remains more than 20 degrees from straight, indicating tight hamstrings. Ely's test is used to detect tightness in the rectus femoris muscle. The patient is positioned prone, lying on their stomach. The examiner passively flexes the patient's knee. The image shows the patient lying prone while the examiner is bending the patient's knee. A positive finding is when the patient's hip flexes during knee flexion, indicating tightness in the rectus femoris muscle. The next test is the Trendelenburg test. This test is used to assess for weakness in the hip abductor muscles, specifically the gluteus medius and minimus. The patient stands on one leg for about 30 seconds, and the examiner observes the level of the pelvis. The image shows a person standing on one leg. A positive finding is when the pelvis drops on the side that is lifted, indicating weakness in the hip abductor muscles on the stance leg. The next test is the standing flexion test. This test is used to detect sacroiliac joint hypomobility or dysfunction. The patient stands with their feet shoulder-width apart, and the examiner palpates their posterior superior iliac spines, or PSIS. The patient then flexes their trunk forward. The image shows the examiner standing behind the patient, with hands on the PSIS, as the patient bends forward. A positive finding is when one PSIS moves earlier or more prominently than the other, indicating potential restriction in the sacroiliac joint. The next test is the long sitting test. This test is used to detect functional leg length discrepancies due to pelvic rotation. The patient is initially positioned supine, and the examiner observes a level of the medial malleoli. The patient is then asked to transition to a sitting position. The image shows the patient transitioning from lying down to sitting up. A positive finding is a change in the level of the medial malleoli when comparing the supine to the sitting positions, indicating a functional leg length discrepancy due to pelvic rotation. Okay, the last test is the leg length discrepancy test. This test is used to measure the length of the legs to identify any discrepancies. The patient is positioned supine, lying on their back. The examiner measures the length of the legs from the anterior superior iliac spine, or ASIS, to the medial malleolus for anatomical length, and from the umbilicus to the medial malleolus for functional length. The image shows the examiner measuring the leg length. Any difference in measurements between the legs indicates a leg length discrepancy. I hope you found this video explanation helpful. If you have any further questions about these special tests, feel free to ask. And if you enjoyed this video, please consider liking, sharing, and subscribing for more content.